Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore. Creating your own healthcare roadmap. Super important, right? Well, you want to have this roadmap as early in your journey as you possibly can. So here to tell us today about how to do that is my friend, I call her Dr. G, Dr. Kaishauna Guidry. She's here in the house. Welcome and thank you so much.
Thank you for having me,
Yeah,
Bryan.
my pleasure. So you and I met through a mutual friend, and I love what you do, and I wanted to get you in here. Tell us about yourself and what it is you do as a mobile concierge doctor.
Wow, we're going to have to sum that up. So about me, I'm a Los Angeles native, born and raised. A Bruin, graduated from UCLA. And I ended up being a stay-at-home mom actually out of college. After being a teacher and being home with my children, I decided I wanted to go to medical school. And my medical school introduced the idea of end-of-life care to us early in our education. And so that's how I got here. That's the short version of who I am. I am a wife. I've been married for 28 years. I am the mother of 3 young adults and a grandmother too.
Grandmother, you do not look old enough to be a grandmother.
G Mother K. G Mother K is my nickname. And I like to say I'm the funnest person you'll ever meet.
You are definitely very fun. I've really enjoyed getting to know you and being around you, and your energy is so positive. Tell us what led you to creating this idea of needing the healthcare roadmap.
You know, so for those of you who don't know me, I did purely become a hospice physician, and I know people are afraid of the H word, but people have to get health care at the end of life. And I learned about it, as I mentioned, in medical school, and that became my niche. Since I was 37 when I went to medical school, I was already well experienced in life. And so taking care of patients and families was something that I had already been doing as a stay-at-home mom, PTA mom, soccer mom, all that stuff that the stay-at-home moms do. And so it was a natural fit for me to do that. And so for the years that I've been doing it, I've obviously seen a lot.
Yeah.
Got to take a breath on that. And so, you know, through seeing all the things that I've seen, I realized that people need help sooner. There's something I can't take credit for this, but I heard it at a conference. People usually crash into hospice after a crisis, after something drastic change. And then, you know, even celebrities, you'll hear something, oh, they're on hospice and then they're gone in 2 days. Well, that's not what Medicare intended. It's supposed to be 6 months. And you know, for people to get the full benefit. So through seeing all these stories, getting back to that, I realized people needed help. And so I created Mourning Dove Medical, a private mobile concierge practice to take care of people right as they're close, or sometimes for those folks who end up, not everyone who goes to hospice care dies, and sometimes they improve because they're getting close, you know, home care, and they need a doctor because you know, they're homebound. And so I started taking care of people at home. And then that has led into books and a podcast and just doing a lot of community service education to help people understand that they need to plan ahead. And that's where the healthcare roadmap comes in.
Yeah. You know, the education piece is so important. You know, I love your books and your podcast, but, you know, what you find is the same thing I find is people don't know what they don't know, you know. If they've never died before, they don't necessarily know what hospice is. Yeah. And so they don't know that they need to know this stuff early. They don't know what hospice really, truly means. They hear the word and like you said, you know, they think someone's going to be dead in 2 days. Yeah. So where ideally would you plug in to the process and how would you help someone on their journey?
So I actually, I'm going to bring up my podcast early. Sorry.
That's fine.
I have an agenda. But I created my podcast for people who are in what I call the late stages of life. And so the late stages of life is typically when they need their children. Well, their children are kind of getting suspicious, like something's going on with mom and dad, or mom is in the hospital more, or something like that. Some trigger, or they need to get home care, or they need to move in with their son. And so I have a library of 2 seasons of podcasts for topics that come up. during that time because, again, people don't want to talk about these things until they have to. And then by then, they're not really absorbing information. By then, they're not having all their faculties to make the best choice to find the best hospice agency, for instance. Um, and so I created these topics, even estate planning, just all those things, physical therapy, home health, there's all those topics so that they know how to be the best consumer and get the best care that they deserve, that they're paying for with their insurance.
Right.
Yeah, so that's how it happened.
Well, and people, again, they don't know what they don't know. They don't know they can pick their own hospice, and they don't know where to look, how to choose. And they're making these decisions generally in a crisis
Yes.
situation. You don't make good decisions when your feet are to the fire, especially when it's for a loved one who, is in that end stages of life. So, tell me a little bit more about the roadmap as far as helping people sort of create that plan.
Yeah, so I'm going to talk more about it when I premiere my season 3 on National Healthcare Decisions Day. That is the day after tax day, everyone. The creator of the podcast is a lawyer. His name is Nathan Kotkamp. He was on my podcast last year talking about it. And so I'll be premiering the components of a roadmap because I want everyone to make their own. Obviously, my patients or clients, they can get one through a family meeting or something like that. But I want people to know what's important. And if you're watching this, it's know the diagnosis that you have attached to your healthcare record, because those are the things that are going to affect you down the road. As you know, in your profession, money and healthcare drives everything.
Yeah.
It determines everything, and it drives your choices that you have. And so know the diagnosis you have, know your functional status, and so that you can have a clear understanding of where you're going. I can just give a quick example. Recently helping someone in the community, and this caregiver, was really adamant and just telling me her mom does not have dementia. And I'm reviewing the medical record, and that's sad to me.
Yeah.
It's not a fight for me, but to not know the things that are on the medical record.
Was she just like putting her head in the sand, do you think? Or why do you think that was?
There are a lot of factors that are going on in this particular case, but patients and caregivers don't really look at the doctor's notes. They may get an after visit summary. Sometimes the diagnoses are on there and sometimes they're not. So a tip I would give is when you go to a hospital, when you go to your appointments, what's the diagnosis? Know that.
Yeah.
If your grandmother's in the ICU, know the diagnoses. What are we treating? What are we doing here? So that you have an understanding or can get more clarity about where you're going. And so the healthcare roadmap is just to assist people to have more details in their healthcare directive, because most people have one. They'll have a trust, they'll have a healthcare directive, but no specifics. It just says, oh, if I don't have capacity, then we'll do this. But
what does that mean?
Do people know that you have mild cognitive impairment? And if you do know that, then how do you plan for it? And maybe you can make choices about where you want to live for yourself instead of your children finding out one day and then they're making choices and budgeting your hard-earned money to put you in a place that you didn't want to stay.
Right. Have that.
But
plan.
you don't have a choice, and you
at that point. Yeah.
Yeah. So I see a lot. I don't want to make it too gory and scary,
Yeah.
but it's about giving people the freedom to make choices and live their best life. It's not about dying. It's about how you want to live your life.
That's important. Tell us about the books.
Okay, these are my books. So the first one I wrote, they were both released actually in 2023.
Which was the first one?
Both of them were released in 2023.
Okay.
So the first one is Dr. G's Hospice Pocket Guide. I wrote that one. Thanks, Bryan. I wrote that one for hospice physicians. Now, everyone does not title themselves a hospice physician. There are a lot of community physicians that may help as a side gig. There are people who go to fellowship and they may do it also, but there was no pocket guide, something to help you know exactly what you're doing every single day. So this is just a small 30-page book to help people know what's up. We do have a larger book. I have to give a shout out to the American Academy of Hospice and Palliative Medicine. There is a hospice physician and hospice medical director manual. But that's like the big Robins.
Yeah.
That's like the big book, you know,
Right.
like your big test for realty.
Right.
But you need to know what to do every day. So
Yeah.
that's what mine is.
Great.
And then the second one is The Real Deal About Hospice, short stories highlighting the advantages of hospice care for patients and
Oh, good.
families. And I co-wrote this with a nurse and end-of-life doula. And basically it is laying out in stories what hospice eligibility looks like. And the chapters, as you will
Yeah.
see, sorry about
You're
that.
good.
The chapters, it's only 9 chapters,
Okay.
and it's dedicated to Jimmy Carter,
Oh, great.
President Carter, who left us, who was on hospice for 22 months.
Yeah.
And it highlights the diagnoses, back to diagnoses, that are most commonly on hospice care.
Okay.
So we have ALS, Alzheimer's disease, cancer, heart disease, HIV, liver disease, pulmonary disease, renal disease, stroke and coma.
Got it.
And if you take note, those are each of the body systems.
Yeah.
So each organ in your body has a pattern at the end stage.
Okay.
If you can just receive that.
Right.
So understanding the trajectory of a disease can help you understand the symptoms that may come up and when it might be time to choose the best hospice care. And I do have a podcast about that, to how to choose the best hospice agency in your zip code.
That makes sense. How can people get these books?
They can get them on Amazon, or they can get them at a lower cost directly from me, and they're personalized. Also, for your teams, you can get bulk orders. You
Okay.
know, some, like I have a friend, she has a cancer support group. She bought some for them. We have hospice agencies buying them for their teams. And so, yeah,
That's
directly
super
from me,
helpful.
from my website.
That's great. And
Mhm.
speaking of website, Dr. G's information is on screen, including her website and her phone number as well. Go to her website. I've been there. Her podcast is there. A wealth of information and resources. Again, before you need it, create your healthcare roadmap. Dr. G, thank you so much for coming and enlightening us today.
Thank you for having me.
Yeah, my pleasure.
All right, Bryan.